Good morning, everyone. Today we are here to discuss the topic ataxia. First, I am going to teach to you what is ataxia. Then, I will explain about introduction and definition of ataxia. Then, we will discuss what are the etiology, causes, types of ataxia, clinical features, and investigation of ataxia. Then, we will discuss what are the therapeutic management, medical management, and lifestyle and support. I am going to share with you about what is ataxia. First, the introduction of ataxia. Ataxia refers to a group of neurological disorders in which motor behavior appears uncoordinated. Walking, speaking, swallowing, writing, reading, and other fine motor activities become abnormal in these patients. Ataxia may result from abnormalities in different parts of the nervous system or different parts of the body. The Greek root ataxis means without order. Ataxia literally means lack of order. It is a neurological sign and symptom that consists of gross lack of coordination of muscle movements. The loss of coordination commonly associated with tremor, that is impaired rapid alternating movements, gait impairment, nystagmus. Next, the definition of ataxia is very simple. What is ataxia? It is a jerky, irrhythmic, inaccurate, purposeless movement. The definition of ataxia, it is a jerky, irrhythmic, inaccurate, purposeless movement. This is the picture of ataxic patient. It is an image of ataxic patient. Next, the etiology of ataxia. The damage, degeneration, or loss of nerve cells in the part of the brain that controls muscle coordination. Cerebellum is the part of brain which controls the muscle coordination, which results in loss of coordination or ataxia. The nerve cells in the brain, cerebellum, the part of brain called cerebellum, little brain. The degeneration or loss of nerve cells in the little brain results in loss of coordination or ataxia. Cerebellum comprises two portions of folded tissue situated at the base of our brain near the brainstem. The right side of our cerebellum controls coordination on the right side of our body. The left side of our cerebellum controls coordination on the left side of our body. But our cerebrum controls, right cerebrum controls left side of the body, and left cerebrum controls right side of the body. There, oppositely, the cerebellum controls the right side of our cerebellum controls coordination on the right side of our body. The left side of our cerebellum controls coordination on the left side of our body. Next, the causes of ataxia. Head trauma. Damage to brain or spinal cord from a blow to the head, such as a car accident, can cause sudden onset ataxia, also known as acute cerebellar ataxia. Next, stroke. When the blood supply to a part of your brain is interrupted or severely reduced, depriving brain tissue of oxygen and nutrients, brain cells begin to die. Next, transient ischemic attack is a cause of ataxia. It is caused by temporary decrease in blood supply to part of our brain. Most transient ischemic attacks last only a few minutes. Loss of coordination and other signs and symptoms of a transient ischemic attack are temporary. Next, cerebral palsy. This is a general term for a group of disorders caused by damage to a child's brain during early development, before, during, or shortly after birth, that affects the child's ability to coordinate body movements. Next, the multiple sclerosis is also a cause for ataxia. Multiple sclerosis is a chronic, potentially debilitating disease that affects our central nervous system, which comprises brain and spinal cord. Next cause is chickenpox. Ataxia can be an uncommon complication of chickenpox and other viral infections. It may appear in the healing stages of the infection and last for days or weeks. Normally, the ataxia resolves completely over time. Next one is the paraneoplastic syndromes. These are rare degenerative disorders triggered by our immune system's response to a cancerous tumor, that is neoplasm, most commonly from lung, ovarian, breast, or lymphatic cancer. Ataxia may appear months or years before the cancer is diagnosed. Next one is tumor. Next, tumor is also a cause for ataxia. A growth on the brain, cancerous or non-cancerous, can damage the cerebellum. Next cause is toxic reaction. Ataxia is a potential side effect of certain medications such as phenobarbital and sedatives, alcohol and drug intoxication, heavy metal poisoning from lead or mercury, and solvent poisoning from paint thinner can cause ataxia. Next, what are the types of ataxia? Sporadic ataxia, hereditary ataxia, autosomal dominant ataxias, and autosomal recessive ataxias. First, what is sporadic ataxia? The sporadic ataxia is the no specific acute or genetic cause can be found. This is known as sporadic degenerative ataxia, which can take a number of forms including multiple system atrophy, which is a progressive degenerative disorder. Next type is hereditary ataxia. The second type is hereditary ataxia. Some type of ataxia and some conditions that cause ataxia are hereditary. Next, the autosomal dominant ataxia. These include spinocerebellar ataxias and the episodic ataxia. Next, the autosomal recessive ataxia. This includes Friedreich's ataxia, ataxia telangiectasia, congenital cerebellar ataxia, and Wilson's disease. What is the Friedreich's ataxia? This is also called the sensory ataxia. Ataxia telangiectasia, this rare progressive childhood disease caused degeneration in the brain and other body systems. Next, the congenital cerebellar ataxia. This type refers to ataxia that results from damage to the cerebellum at birth. Wilson's disease. People with this condition accumulate copper in their brains, livers, and other organs, which can cause neurological problems, including ataxia. These are the types of ataxia. Next, the clinical features of ataxia. First one is the dysmetria is one of the clinical feature of ataxia. What is dysmetria? It is the difficulty to judge the direction, distance, extent, force, and timing of the limb movement. There are two types of dysmetria. One is hypometria and other one is hypermetria. What is hypometria? Deficient extent of movement. The patient shoots the limb well in front of the target. That is hypometria. And the second type is the hypermetria. Excessive extent of movement is the hypermetria. The patient shoots the limb beyond the target. Next clinical feature is dyssynergia. It is the disturbance of smooth muscular coordination resulting in uncoordination and abrupt movements. Next, the clinical feature is rebound phenomenon. When a patient is made to contract the muscle isometrically and suddenly removes the resistance force, the limb moves abruptly, lacking the control. Next clinical feature is dysdiadokinesia. It is difficulty in performing rapid alternative movements. If the patient is unable to perform rapid alternative movements, then it is called dysdiadokinesia. Next, the adiadokinesia is the inability to reverse the direction of the movement. Next clinical feature is the tremor. Tremor, the oscillatory movement about a joint. There is intentional tremor, postural tremor, titubation. What is the intentional tremor? It occurs during the movements. Next, the postural tremor may be evident by back and forth oscillatory movements of the body while maintaining a standing posture. Postural tremors may also be observed as up and down oscillatory movements of a limb when it is held in anti-gravity position. What is the titubation? It refers to rhythmic oscillation of the head side to side, forward and backward, or may have rotatory components. Next, the clinical feature is hypotonia. Hypotonia means the reduced tone or diminished resistance to the passive movements. Next clinical feature is dysarthria. This is the disorder of speech articulation. Here the speech is slow and slurred. That means the scanning speech, one word at one time. The speech pattern is very slow, hesitant, with prolonged syllables and inappropriate pauses. Next clinical feature is the ocular disturbances. The main ocular disturbance is nystagmus. It is a form of involuntary or seesaw rhythmic eye movement. The most common type of nystagmus is called gaspartic nystagmus, in which there is inability to hold eccentric position or gaze, resulting in need to make repetitive saccades to look eccentrically. Other type of nystagmus are downbeat nystagmus and rebound phenomenon nystagmus. Voluntary gaze is accomplished by a series of jerky movements which is called saccadic dysmetria. Ocular flutter, in which there is occasional burst of very rapid to and fro flutter like horizontal oscillation around the point of fixation. Next clinical feature is the gait changes, broad-based gait or ataxic gait seen in the ataxic patients. Next clinical feature is the cognitive and mood problems. In addition to motor dysfunction, patients with cerebellar degeneration may have cognitive and emotional difficulties. Next, the investigation. Here is the here is an image of ataxia. There is ataxia symptoms, lack of coordination, eye movement abnormalities, slurred speech, trouble eating and swallowing, heart problems, tremors and deterioration of fine motor skills, gait abnormalities, difficulty walking and poor balance. Here in on left side there is brain and the parts of brain and the neuromuscular junction. Next is the investigation and diagnostic approach. A diagnostic approach to ataxia may include neurological and medical history, including drug and toxin exposures, family history of neurological problems, neurological and medical examinations, blood tests to rule out specific deficiencies and toxins, urine screen for mercury exposure, brain imaging, that is MRI or CT, possible neuroimaging imaging of the spinal cord, electrophysiological testing, that is EMG, and nerve conduction velocity testing. These are the investigations and diagnostic approach. Next, about the management. Ataxia management involves a multidisciplinary approach focused on addressing symptoms and underlying causes, which may include physical, occupational, and speech therapy to improve coordination, daily tasks, and swallowing. Treatment can also involve medications for specific symptoms, adaptive devices like walkers and cans, and managing underlying causes like nutritional deficiencies, infections, or toxic exposures. For some types like episodic ataxia, avoiding triggers like alcohol and caffeine is also recommended. Next, about the medical and therapeutic management. Physical therapy. About physiotherapy focuses on improving balance, core strength, coordination, and gait. Next, about the attacks. Occupational therapy helps with daily living activities such as eating, dressing, and home safety. And next, the speech therapy address speech difficulties and swallowing problems, which is crucial for safety and nutrition. And some medications are prescribed to manage specific symptoms like the muscle stiffness, tremors, bladder control, or eye movement issues. For some episodic ataxias, medications like acetazolamide may be used. Adaptive devices can also help maintain independence and safety, including cans, walkers, and wheelchairs. And last, at least the lifestyle and support. Regular exercise is very important. Aerobic and strengthen exercise can also help to maintain or improve physical function, and support groups connecting with others who have ataxia can provide information and emotional support. Their diet for ataxia. For some types of ataxia, managing diet is important. For example, avoiding triggers like high fructose corn syrup, sugar, and caffeine may be beneficial. And very important is counseling, addressing potential depression and anxiety associated with living with ataxia can be beneficial. These are about ataxia. Thank you.